Diabetes Prevention and Management. This is a video about diabetes made by Diabetes Victoria. We will look at a range of topics including the impact of diabetes in Australia, how your body uses food and how it relates to diabetes, the types of diabetes, type 2 diabetes symptoms and risk factors, how to reduce your risk of type 2 diabetes, tips for managing your diabetes, who can support you, and where you can find out more information about diabetes. So let's look at diabetes and how it impacts us in Australia. Studies in 2016 showed that diabetes is the fastest growing condition in Australia. Approximately 1.7 million Australians are affected by diabetes, and 280 Australians are diagnosed every day. It is clear that diabetes is a serious issue, but there is a lot we can do to reduce our risk and improve our health. Firstly, it is important to understand how our bodies use food and how this relates to diabetes. All parts of our bodies, including the brain, heart and muscles, need energy to function, and this energy comes from the food we eat. Carbohydrate foods are a great source of energy. When we eat carbohydrate food, our body breaks it down into glucose and it is then absorbed into the bloodstream. Our bodies produce insulin to help transfer the glucose from the bloodstream into the body's cells so it can be used as energy. Let's take a moment to identify the three main types of diabetes: type 1, type 2, and gestational diabetes. Today we are going to focus on type 2 diabetes. Type 2 diabetes is a condition where the pancreas still makes insulin, but it may not make enough, or the insulin that is being made does not do its job properly. When a person is in the early stages of having type 2 diabetes, the pancreas works harder to try and make more insulin than usual. This happens because the pancreas is trying to help the glucose enter the cells and helps the body get the energy it needs. If the beta cells in the pancreas continue to work hard, they get tired and they make less insulin. This makes it harder to keep blood glucose levels in target. This is why type 2 diabetes is often called a progressive condition, meaning it gets worse over time. People with type 2 diabetes often have no symptoms, so they may have diabetes for a number of years without knowing it. Sometimes, the first sign that they know something is wrong is when they develop a complication of diabetes, such as a heart attack, vision problems, or a stroke. This is why it is important to look out for symptoms like the 3 T's: tired, toilet, and thirst. Tired. Increased tiredness and a lack of energy. Toilet. Constantly needing to urinate, and thirst. When you're always thirsty. Other symptoms may include blurred vision, recurring infections, or cuts and wounds that take a long time to heal. Diabetes can affect the body in a number of ways, including damage to large blood vessels such as the heart, brain, and legs, and damage to small blood vessels such as the kidneys, eyes, feet, nerves, and teeth and gums. Diabetes can also lead to sexual problems as a result of nerve and blood vessel damage. While there is no single cause of type 2 diabetes, there are well-known risk factors. Some risk factors cannot be changed, such as family history, age, where you were born, gestational diabetes, polycystic ovarian syndrome, or if you've had a previous heart attack or heart disease. Other lifestyle factors which you can change include weight, physical activity, blood pressure, cholesterol, and smoking. So what can you do to reduce your risk? Up to 60% of type 2 diabetes can be prevented. People at risk of type 2 diabetes can delay and even prevent this condition by following a healthy lifestyle. To help you reduce your risk, we recommend you eat healthy food, limit your alcohol intake, be as active as you can and sit less, don't smoke or try to quit, and have regular medical checks. Let's first look at healthy eating. Healthy eating is important for everyone and not just if you have diabetes. Let's take a look at the Diabetes Victoria healthy eating clip to learn more about making healthy food choices.
Healthy eating helps you feel happier and healthier. To be healthy, it's recommended that you eat a variety of foods from each of the different food groups. Try to eat more high-fibre foods. Eat less of the foods that are high in fat, have added sugar and salt. Drink less alcohol and be as active as you can every day. Healthy eating is about finding a balance between the foods you should eat more of every day and the foods that are best to eat occasionally. So, what does this mean? Let's take a closer look. Foods from the grains and cereals group are a good source of carbohydrates. Carbohydrates are very important because our brain and muscles need them for energy. Grain and cereal foods can be broken up into 4 main groups. These are breads, breakfast cereals, grains and other products. Most adults need to eat between 3 and 6 serves of grains and cereals every day. So what does a serve look like? When choosing grain and cereal foods, look for those that are whole grain and high in fibre. These are good to eat every day as they have more vitamins and minerals than processed varieties, and they help you feel fuller for longer. In Australia, we have access to a wide variety of different fruits. Fruit is a good source of fibre and contains lots of different vitamins and minerals. Fruit is a great snack as you can take it anywhere, and it's a very healthy dessert option. Aim to eat at least 2 serves of fruit each day. So, what does a serve look like? All types of fruit can be eaten every day. Where possible, try to eat fresh fruit. If it is the type of fruit that you can eat with the skin on, you should, as this is a source of fibre. There are many different types of vegetables and legumes grown in Australia that are available right throughout the year. It's important to eat a variety of different types of vegetables, beans and legumes each day. Try to eat a range of different colours. Starchy vegetables such as sweet potato, taro, cassava or sweet corn should form only a small part of your daily vegetable intake. Aim to eat at least 2 serves of beans and legumes a week and at least 5 serves of vegetables each day. So, what does this look like? It can be hard work trying to eat 5 serves of vegetables each day. However, you can do almost anything with vegetables. Eat them raw as a snack. Grate them and add them to pasta sauces and vegetable bakes. Slice them and add them to soups and salads. Stir fry, steam, boil or bake them. Dairy and its alternatives are a great source of protein and calcium, which help to keep our bones and teeth strong. Aim to eat 2 to 4 serves of dairy or alternatives every day. So, what does a serve look like? Full-fat dairy is high in saturated fat, which is bad for your heart, so always choose reduced fat options. Eating dairy foods is the easiest way to meet your calcium requirements. However, you can get some calcium from other foods. We are lucky in Australia to have a great variety of different meats and alternatives. These foods are an important source of protein and iron, which is needed for the repair and rebuilding of our muscles, organs and other tissues, as well as keeping our blood cells healthy. Aim to eat 2 to 3 small servings of these foods each day. So, what does a serve look like? When choosing these foods, try to choose fresh, unprocessed meats. A handy hint for remembering the portion size of meats and alternatives is to think of the palm of your hand as the same size as 2 serves. Oily fish, such as salmon, sardines, mackerel and herring, are a good source of unsaturated or healthy fats, which are great for your heart. Try to include 2 to 3 serves of these fish each week. You may have been told in the past to reduce all types of fat in your diet. What is important is eating the right types of fat so that our heart and brain can stay healthy and to reduce the risk of heart attack and stroke. Eating too much fat, even healthy fat, can contribute to weight gain, so use it in small amounts. So, what does a small amount look like? Fat is needed for healthy heart and brain function and has an important role in our body, including helping to absorb some vitamins and forming part of our cell walls. Did you know that keeping hydrated is just as important as eating healthy foods? Always try to choose water before anything else. For people who drink alcohol, it's recommended that you drink no more than 2 standard drinks each day, and that you aim to have a few alcohol-free days each week. So, what is a standard drink? If you have diabetes and you are on insulin or taking certain types of diabetes tablets, then alcohol can cause your blood glucose levels to drop. You will need to talk to your doctor to see if it's safe for you to drink alcohol. Let's look back on these healthy eating messages. Eating the recommended amount from each food group is easier than you think. Let's see how you can do this. Eat 3 to 6 serves of whole grain or wholemeal grains and cereals. Eat 2 to 3 serves of lean meats or alternatives. Eat 5 or more serves of vegetables, legumes and beans. Eat at least 2 serves of fruit. And eat 2 to 4 serves of low-fat dairy foods or alternatives. So, what does this look like when we put it all together as meals? Breakfast is the most important meal of the day, as it gives you the energy you need to refuel your body after a night of rest. Your breakfast should include some high-fibre bread, cereals or grains to give you the energy you need to get you through the morning. Try adding some protein from some low-fat dairy or an egg and some fruit and vegetables for a balanced meal. Just like breakfast, your other meals should also be high in fibre. Include a source of protein, plenty of vegetables or salad, and some legumes or whole grains. For some people, it's a good idea to have a small snack between your main meals to stop you from feeling too hungry or overeating. A healthy snack is low in fat and added sugar and can also be a good source of fibre. Some foods and drinks do not fit into the 5 food groups because they are not necessary for a healthy diet. It's best to try and avoid these foods and drinks. However, they can be enjoyed on special occasions in small amounts. Eating too much food, even if it is healthy, can lead to weight gain. Reducing the size of your meals is one of the easiest things you can do to help you maintain a healthy weight. If you divide your plate up into parts, aim to fill at least half of your plate with non-starchy vegetables or salad. Your protein portion should take up a quarter of your plate. Your carbohydrate portion should take up another quarter of your plate. Eating out at restaurants or buying takeaway foods can be enjoyed on occasion. When you're buying takeaway foods, try to make healthier choices where possible. It's best to limit takeaway foods as much as possible. Perhaps enjoy them on special occasions or no more than once per week. The way that we cook is just as important as the type of foods that we choose. try to choose cooking methods that reduce the amount of fat in your meals. If you have any questions about diabetes or healthy eating, Diabetes Australia Victoria provides a free and confidential telephone advice and support service. You can call 1300 136 588 and ask to speak to a diabetes nurse educator, dietitian or advocacy officer. If you're in Victoria, you can access the Diabetes Multilingual Info Line on 1300 801 164 or the Koori Diabetes Info Line on 1300 Koori, free of charge. Please note that these are not an emergency service. If you require urgent advice or help, you should call 000.
Remember, healthy eating can be achieved with these small manageable steps. Eat less saturated fat. Eat more healthy fats. Eat less added sugar. Eat lots of different coloured fruit and vegetables each day. Eat more high fibre foods. Eat less salt. Drink less alcohol. And drink lots of water. Also, think about how you can get your family involved, because healthy eating is important for the whole family. As well as healthy eating, it is important to keep active. Physical activity is important for health and well-being, whether you have diabetes or not. We recommend you try to get around 2.5 to 5 hours of moderate intensity physical activity, or 1.25 to 2.5 hours of vigorous intensity physical activity each week. You may also like to try a combination of moderate and vigorous activity. Please only take part in vigorous activity if you are able to, or if you have checked with your doctor. We also recommend you do muscle strengthening activities on at least 2 days each week. Remember, you can be active in many ways, and anything that gets you moving is great. It is good to incorporate a variety of stretching, strength, and balance activities into your routine. Stretching activities may include Tai Chi, yoga, or Pilates. Strength activities may include weight training, squats, or resistance training. And balance activities may include yoga, balancing on one leg, or chair exercises. To help you get the most out of your exercise, we recommend you break the activity up throughout the day, be active in different ways, talk to your doctor about what exercises you can do, exercise with a friend, and have fun. There are other ways to help you reduce your risk of type 2 diabetes and improve your general health and well-being. Smoking can increase the risk of serious health problems associated with diabetes. You can significantly improve your health by quitting. Quitting at any age will benefit your health, but the earlier you stop, the more you gain. You will increase your chance of success by planning your efforts to quit and getting support from your doctor, the Quit Line, and your friends and family. So let's recap on the main points and take a moment to reflect on how you can make the following changes in your life. Enjoy healthy eating. Limit alcohol. Be as active as you can. Don't smoke. And have regular medical checks. For those who have type 2 diabetes, managing diabetes includes making sure blood glucose levels, cholesterol, and blood pressure are as close to target as possible. We recommend you check your blood glucose often. Check how your diabetes is going with the HbA1c blood test every 3 to 6 months. Check your blood glucose before driving. And see your doctor if you are unwell or your blood glucose is over 15. To help you manage your diabetes, we recommend you have a cholesterol check every year, blood pressure check every 3 to 6 months or more if you have high blood pressure, eye check every 2 years, heart check every year, kidney check at least every year. To check the kidneys, it is important to get both a urine and blood test. Check your feet daily and see your podiatrist at least every year or more often if required. Look after your teeth and see your dentist at least every year or more often if required. And look at your diabetes plan. While there are lots of things you can do to help reduce your risk of diabetes day to day, or to help manage your diabetes, there will be times when you will need help from health professionals. During these times, we encourage you to speak to your doctor, a diabetes nurse educator, a dietitian, a podiatrist, a dentist, your local community health centre, or Diabetes Victoria. There are a number of affordable options to see a dietitian or diabetes educator in your community. We recommend you speak to your doctor to find out more. With the right support, you can live well with diabetes. At Diabetes Victoria, we offer a variety of programs for those at risk and those with diabetes. These include prevention programs, management programs, written audio and visual resources, and the Diabetes Victoria website, www.diabetesvic.org.au. A number of our resources are also available in multiple languages. If you have any questions about diabetes, need help finding a resource, or just need some support, call Diabetes Victoria on 1300 801 164 and speak to someone in your language. When you dial the number, make sure you say your preferred language in English, and please be patient. It can take a couple of minutes to get an interpreter on the line. The NDSS, or National Diabetes Services Scheme, also has many benefits for you to consider, such as free information and support, subsidized testing strips for monitoring blood glucose levels, free insulin syringes and pen needles, and subsidized insulin pump equipment. We encourage you to join the NDSS and promote its services in your community. Registration is free and resources are free. For more information, there are brochures on our website at www.diabetesvic.org.au, or you can check out the NDSS website at www.ndss.com.au. Thank you for watching this video about diabetes prevention and management. We really value your feedback, and if you have any comments about this video or our programs and resources, please let us know.